Hello and welcome. Today we're diving into a rare and complex liver condition called Budd-Chiari syndrome. This disorder affects the veins that drain blood from the liver, leading to potentially serious complications. Join us as we explore its causes, symptoms, diagnosis, and treatment options. So, what causes Budd-Chiari syndrome? In essence, it arises from an obstruction of the hepatic veins, which carry blood out of the liver. This blockage can stem from a variety of factors. Common causes include blood clotting disorders like polycythemia vera and antiphospholipid syndrome. Other potential culprits are myeloproliferative neoplasms, certain cancers that can invade or compress the veins, inflammatory conditions like Behçet's disease, and even the use of oral contraceptives in some individuals. In some cases, the cause remains unidentified, a condition termed idiopathic Budd-Chiari syndrome. Understanding the pathophysiology is crucial. When the hepatic veins are blocked, blood flow out of the liver is severely restricted. This leads to a backup of blood within the liver itself, causing congestion and increased pressure in the liver's blood vessels. Over time, this congestion can lead to liver cell damage, scarring, known as cirrhosis, and ultimately, liver failure. The increased pressure can also cause ascites, the accumulation of fluid in the abdominal cavity, and splenomegaly, enlargement of the spleen, as blood backs up into the portal venous system. Budd-Chiari syndrome is considered a rare disease. Estimates suggest it affects about 1 in 1 million people. While it can occur at any age, it's most frequently diagnosed in adults between the ages of 20 and 50. Certain geographic regions and populations, particularly those with higher rates of underlying blood clotting disorders, may experience a slightly higher incidence. The signs and symptoms of Budd-Chiari syndrome can vary depending on the severity and the speed at which the condition develops. Some individuals may experience a gradual onset of symptoms, while others may have a more acute presentation. Common symptoms include abdominal pain, often in the upper right quadrant, abdominal swelling due to ascites, jaundice, which is a yellowing of the skin and eyes, an enlarged liver, and fatigue. In more severe cases, patients may develop variceal bleeding, which are enlarged veins in the esophagus or stomach that can rupture and bleed. Diagnosing Budd-Chiari syndrome typically involves a combination of imaging studies and blood tests. Liver function tests can reveal abnormalities in liver enzymes. Imaging techniques such as ultrasound, CT scans, and MRI are essential for visualizing the liver and hepatic veins, allowing doctors to identify any blockages or abnormalities. A liver biopsy may also be performed to assess the extent of liver damage and rule out other potential causes. In some cases, a venogram, which involves injecting dye into the hepatic veins and taking X-rays, may be necessary to confirm the diagnosis. While Budd-Chiari syndrome isn't strictly classified into specific types, it's often categorized based on the location and extent of the venous obstruction. Some individuals may have blockages in the main hepatic veins, while others may have obstruction of smaller branches within the liver. The severity of the underlying liver disease also influences the clinical presentation and management. Treatment for Budd-Chiari syndrome aims to relieve the obstruction, manage the symptoms, and prevent further liver damage. Initial treatment often involves medications to prevent blood clots, such as anticoagulants. Procedures like angioplasty with stenting, which involves widening the blocked veins with a balloon and placing a stent to keep them open, may be used to restore blood flow. A transjugular intrahepatic portosystemic shunt, or TIPES procedure, may be necessary in some cases to create a new channel for blood to flow around the blocked veins. In severe cases of liver failure, a liver transplant may be the only life-saving option. Unfortunately, there's no specific way to completely prevent Budd-Chiari syndrome, as many of its underlying causes are not preventable. However, managing risk factors associated with blood clotting disorders, such as maintaining a healthy lifestyle, avoiding smoking, and carefully considering the use of oral contraceptives, may help to reduce the overall risk. Early diagnosis and treatment of underlying conditions like myeloproliferative neoplasms can also be beneficial. The prognosis for Budd-Chiari syndrome varies depending on the severity of the condition, the underlying cause, and the effectiveness of treatment. Early diagnosis and prompt treatment can significantly improve outcomes. Without treatment, Budd-Chiari syndrome can lead to progressive liver failure and death. Recent research has focused on improving diagnostic techniques, refining treatment strategies, and developing new medications to prevent blood clots and reduce liver inflammation. Studies are also exploring the potential of targeted therapies to address specific underlying causes of the syndrome, offering hope for improved outcomes in the future.